My name is Professor Carsten Knobloch. I'm a German surgeon. I'm educated in Hanover Medical School and a board certified in plastic and reconstructive surgery, in hand surgery, in general surgery, in emergency medicine and in sports medicine. I'm a member of the American Society of Plastic Surgeons, a fellow of the American College of Surgeons, and I'm running a private practice like 닥터K의 here in Seoul since 2012. So I'm seeing in the autumn of this year my 10th anniversary in my private practice. And I'm in the moment the Vice President of the International Society for Medical Shockwave Therapy and the General Secretary of the German Shockwave Society.
안녕하세요. 가정의학과 전문의 고정아입니다. 저는 서울대학교 병원에서 가정의학과 수련을 마치고 펠로우를 한 후에 태릉 내셔널 스포츠 센터에서 팀 닥터로 근무를 했습니다. 이제 그때 체해 충격파를 많이 접하게 되었는데요. 요즘에는 이제 미용의학에서 수술이나 시술 후 여러 가지 부작용을 겪고 있는 흉 조직에 대한 치료, 그리고 셀룰라이트에 충격파 적용하는 치료를 중점적으로 좀 하고 있습니다. 마침 이제 올해 오랜만에 이제 쇼크웨이브 서울이라는 체해 충격파에 관련된 국제 세미나가 열리게 되었는데요. 이제 닥터K가 이제 충격파의 권위자로서 이번에 같이 강연을 하게 되었고요. 저희가 최근 이제 여러 가지 새로 시행되고 있는 그런 최신 지견이나 충격파의 미용의학의 적용 등을 좀 소개해드릴 수 있는 자리가 될 것 같습니다. I'd like to introduce our book ESWT in Aesthetic Medicine, which Dr. K wrote and I translated. Please introduce this book.
It is a distinct pleasure that Dr. Ko made the efforts to translate this English book into Korean. In the late 2010s, I developed the idea of a comprehensive handbook on aesthetics, or shockwaves in aesthetics, in reconstructive surgery, and in dermatology and in burn injuries. And we compiled it as a multi-author book with different international authors. And it was published first in English in 2018, and I think in 2019 or 2020 it came into Korean. So it is a big pleasure for me that this book gets even traction in South Korea.
Lately, there's been a growing interest in non-invasive and regenerative medicine in aesthetic medicine. So I think this book, it will be an introductory book who want to use ESWT in aesthetic medicine. Thank you.
I started myself with shockwaves in 2006. And at that point of time, I was working in the University for Plastic and Hand and Reconstructive Surgery. So we had both plastic, reconstructive, and a burn unit. And usually in Germany, the university is not so strong in the aesthetic field. Usually it is more in the private sector. And at that point of time, I thought it is wise to evaluate the shock waves in cellulite, because there were already some encouraging early studies, 2005, 2006. And I thought to do a randomized control trial to get an idea of whether or not cellulite is changed by shockwave. And it appeared as a non-invasive measure, as you said, very or free of any risks for the patient. So that's why I thought it is wise to introduce it into the cosmetic field as well.
I know this treatment is a kind of aesthetic medicine, but I think it's a kind of recovery treatment. Shockwave do not harm to the tissue, and shockwave act not only in the skin, but also facial, or fat layer, and cell matrix exchange material. So I think I can use this shockwave to recover our damaged tissue. So I like to use this shockwave to aesthetic medicine or regenerative medicine now.
I fully agree, because in the field of musculoskeletal medicine, in sports medicine, for example, we know that shock waves can accelerate the healing of a painful tendon, of a broken bone, of a damaged muscle. So it appears, because shock waves let's say, modify the healing response, and they can accelerate the healing of tissues. And we know, for example, from burns, that burn wounds heal 3-4 days faster with the application of shockwaves. So it is a healing accelerator, and it's free of risks.
What's the proportion of the aesthetic ESWT application in your field?
Okay, in my practice, my practice is much more into musculoskeletal issues, because my practice is a sports medicine practice. But I see both females and lately even males who have very good results with shockwaves on their tendons and their muscles, that they ask for shockwave for the face, for example, because they want to have, let's say, less wrinkles, and they ask for the application of shockwaves in the aesthetics, especially in the face.
Yes. In my case, the scar tissue treatment of ESWT account for about 1/3 of the total case. What is the overall satisfaction of the patient of your ESWT application in aesthetic medicine?
I think they are very, very satisfied overall. Regardless of the technology, I believe it is very important to manage the expectations of the patient. So to get a good initial assessment with diagnostic tools, as you do the 3D photography and assessments, this is very important in my view, and then to sincerely inform the patient what can he expect with, say, shockwaves. And if the right patients are selected with the good expectations, then they will be very satisfied. That's my impression.
You have objective results, photo scan. Many people satisfied with going back to their pre-condition, pre-surgery condition, especially for those who have suffered nerve damage, fat layer adhesion, nodules, elevate muscle tension, highly satisfied after ESWT treatment.
Because, you know, we'll talk later on it, there is the observation in neurology when spasticity is treated with shockwaves, and this was a very early idea, even in the mid-90s, that a German doctor treated spasticity with shockwaves. And later, as you know, botulinum toxin came into play in the ophthalmology first, because of the high tension in the eye muscles, and then by chance it came to wrinkles, and now shockwaves are coming to treat wrinkles when they are, say, prone to be treated with botulinum toxin as well. That's what you said. So the detensioning of the muscle is very important. Yes.
Okay.
I lately had a male patient, and the history is that he, say, 3-4 years ago came into my practice because he heard that shockwaves are good for erectile dysfunction. And he was treated by a urologist first, and he was not so satisfied with his application of shockwaves. So he went to my practice, and I treated him for ED. Then he suffered a hyaluronic acid injection accident because he had some granulomas and severe swelling of his lips because he had an allergic reaction. Then a plastic surgeon came and injected 3 times hyalurase to resolve the hyaluronic acid with even stronger allergic reaction, with very big swollen lips and scar sphere. And he came to me and asked, what can we do? And I said, okay, we can try shockwaves, both radial and focused, as we did on his different locations. And we could show after 3-4 sessions a softening of the nodules, and the swelling was significantly reduced. So shockwaves could help him in his, even in, say, in his damaged situation after hyaluronic acid injections and allergic reactions.
You applied the very early phase of the inflammation reaction,
Right.
But it was effective.
Yes.
Yeah. He has the two problems, erectile dysfunction and the high hyaluronic acid allergy. Okay. You treated both of them? Okay, great. You're better than urologist. Okay. My patient was also a male patient. Male patient in 30s underwent osseous genioplasty. But he complained pain and discomfort on his chin and tightness. Due to his tightness on his chin, he had insomnia. So he visited my clinic and I applied ESWT to his chin. Yes, and after treatment, his chin moved well. So another problem was happened because his chin moved well. The shape became more uneven. Yes, so I explained him this information and continued to treatment, and eventually it has improved both of them, shape and the function. Many clinics recommend a Botox to their chin, but I don't recommend it because of the function of muscle.
Right.
My clinic, many patients visited due to the side effect after aesthetic surgery. Some patients suffer from nerve damage or physical appearance, and they had any discomfort to move their chin or muscle. So I applied ESWT to their muscle or fat layer. If they get Botox, I cannot notice the improvement of their function, so I don't like Botox. ESWT first, and after treatment, I give choice to them more about Botox. Okay.
There are a number of reasons in my view. So actually I started in 2006, as I mentioned, with a focus device only at that point of time. The nice thing with Storz is that you can even have focused and radial applicators in one machine combined.
Yes.
And this is the only competitor in the moment in the market who provides it. Because there are manufacturers who provide radial machines or focused machines, but there is no combination therapy in the moment. This is one argument.
Yes.
Second argument is there is a continuous achievement in improving their products and coming out with new product identities.
Yes.
So we, for example, can have different applicators like this Atlas applicator where we can soften the facial skin around the eye, for example. And the newest kit in town is this applicator called ST20, which is comprised of a very nice silicone tip and which is very soft, and you can even exchange the silicone tip from patient to patient for hygienic reasons, for example. And then you can really softly treat with these ST20 applicator, for example, face or scars which are very painful, or locations where you usually exert some pain. So there is continuous development within the company, and that's the reason why I'm very happy to be a part of the Storz family.
I like using Storz Shockwave because it's stable and safe. Also, it has a constant depth of treatment. I usually use it on face, so stable output, energy depth and intensity are very important to me. And the Storz Shockwave developed a new transmitter. Yes, I also like that. So we can use a wide range of choices.
And there is, even if we consider only the focus devices, we just did a study on the electromagnetic focus device. the electrohydraulic, which was the previously, and the piezoelectric. And we measured the noise with the machines. And we could show that the Storz machines had less noise than piezoelectric, and the most loud were the electrohydraulic machines, were very, very loud. And if you, for example, treat the face, you can imagine if you are near the ear, you exert some problems, even in this noise dimension. So loudness might play a role in this decision as well.
Okay. Even though I use a Storz shockwave, I always ask my patient, "Do you have any tinnitus? Are you okay?" But it's very silent machine.
Right. The most silent in the market.
It's good.
So in my history, I started, as I mentioned, in 2006. I used focused only for the first 6 years. So in 2012, 10 years ago, I started to use focused and radial in combination. So my first cellulite trial, for example, was focused only. And then in the past 10 years, since 10 years, I now combine focused and radial, first for cellulite, and now even for the face. So the patient I mentioned with the scars after hyaluronic acid or filler injections and the allergic reactions was treated with focused and with radial in one session, because I have different energy levels. And I believe, for example, that the focus is even stronger in scars or in fibrosis, while the radial is maybe stronger, more superficial, and even for lymphatic drainage. And usually we see different frequencies. So focused is usually, say, depending on your energy, 4 or 5 or 6 hertz. And I usually use the radial with 8 to 10 hertz, a bit faster. So that's why I'm now, for 10 years, combine radial and focus in one session. Because I believe, and there is some evidence in musculoskeletal and tendons, for example, that the combination is better than radial or focused alone.
I usually like to use they together, but I use it alone depending on the treatment purpose or patient status. Some patients underwent osseous facial surgery, so they don't want any sound or any pressure. So I decide which type is better to this patient, but I usually like to use it together.
And with the help with the new, say, applicators with this Atlas or even with the even softer ST20, you might even apply radial pressures in the face, which is not possible with a conventional steel applicator because it's too painful and they are much more softer. So this might be an option in these patients as well.
I will use it.
So over the past 15, 17 years, I changed my understanding in energies. When we were 15 years back, I thought, and others as well, that high energy is very important, and we could not think about any effect with low energy. Over the past 20 years, we saw that with lower energy levels, we could even be stronger in a regenerative way. And in the moment, my understanding is so that depending on the tissue I want to treat, I choose my appropriate energy. Say, skin or nerves only need very, very low energy levels. I call them nano-energetic. So if I want to treat a facial nerve or peripheral nerve, I can achieve it with very, very low energies. In the face, I usually can change it with low energies as well. If I want to treat, say, muscles, I have to have a bit higher, medium energy. And if I want to treat in the face, for example, a bone which is not healing after surgery, we need higher energy. So it really depends on what tissues I want to treat, and then I can choose my energy levels. But for, say, aesthetic reasons, I usually only apply nano-energetic or low-energetic, because then it's quite fine and it's not painful.
Especially for nerve. Have you ever had a side effect when you treated with high energies?
I treat myself with the machines as well, and I try everything on my own, as all of you know, all applicators and even the focus. So I have mapped my own face, and I know where the painful regions are. Usually the regions are where nerve is coming to the surface, or if you have, say, the sphenoids. And if you are over the sphenoids, for example, it is much more painful. Or if you have some tooth problems, you might, or infections in the tooth, you might see it. If you are around there, it's very painful because it's not painful for the skin, but for the tooth as well. So that's why there are sometimes locations in the face which are more prone to be painful.
Yes, but if we want to apply stability on this delicate area, do you use any other equipment or modality?
I usually start with very low energies, so that the patient, regardless if I start with radial or focus, will feel nothing in the very beginning. So I start low and slow, and then increase just step by step my energy levels or my pressures to see if the patient is feeling something. So I'm not starting with high energy. So start low and slow and then increase it.